Hi guys, welcome back to the show. This is my podcast, Health by Hirsch, where we talk about all things perimenopause, menopause, and hormone replacement therapy. In this week's episode, I want to talk about how do you know if you're really working with an expert. Now, a lot of you are learning so much when it comes to all of these topics. And then when you go to see somebody, you want to know that you're going to be getting the best care. So I have 4 things that you should be looking out for so that you know you're working with an expert. Now, why is that important? Because I want you to have a good experience when you finally get to go and speak with somebody about what you've been going through, what you've been feeling, and ultimately how you can get treated. And if you have a bad experience, it can really leave a sour taste in your mouth, right? You might not like your hormone therapy, you might not like the person that you're working with, and you just ultimately might just throw everything in the trash and you don't even want to go back there again. So you want to have a good experience. After I tell you the 4 things I want you to look for, I'm going to tell you where you can go, because actually that is the most common question that I get. Now that I know this, where is that expert that I can have this wonderful experience with? So if you're interested, that's what we're going to be talking about, so stick around. The first thing to look for is someone who can help you navigate the system. So what do I mean by that? Well, it's probably no surprise to you and to me also, I'm a patient, that a lot of clinicians, whether they're DOs, MDs, nurse practitioners, physicians assistants, or our allied healthcare professionals, like our licensed social workers, healthcare professionals, pelvic floor physical therapists, they all kind of work in a silo. And that's not necessarily to our advantage, right? Because you're going to one doctor telling them what that one told you, and you're kind of like the third party messenger, and you're telling them, and then you're trying to coordinate everything. And this can already be really frustrating. It's unfortunate. We can absolutely talk about how we've gotten there, but we're here, let's face it. And even I know as a mom, when I'm trying to navigate my daughter's different appointments, how exhausting it is. And I am a physician. So everyone kind of exists in these little silos. You want someone who can help you navigate the system. Why? Because someone who's doing menopausal medicine or hormone replacement therapy with you might really confuse the whole story, right? It's one thing to tell the podiatrist what the internal medicine or family medicine doctor told you about why you might have toe fungus. That you got covered, right? But when it comes to why are you using estrogen when you're still having periods and you're in perimenopause, but what about the mental health? It can get confusing. So you want someone who can actually help you navigate the system. And by that, I actually mean a couple of things. First, really explain to you quite clearly where they fit in this entire experience. Second, be available to answer any questions between what you two discuss and, say, your primary care doctor or your OBGYN. Now, in clinical practice, this happens to me all the time. I might recommend for my patients that maybe after so much continued bleeding, they reduce their dose of hormone therapy. Their doctor might say they need a procedure. They're in the middle of 2 doctors that they really like and respect, and they're not sure how to handle the situation. This is just a hypothetical one, but you can probably already imagine a couple of different, scenarios like that. And you want someone who will reach out and say why they might think you don't necessarily need that procedure just yet. They have more experience, expertise, and they feel more relaxed about the situation. You might, for example, have a scenario where you have had a gynecologic cancer and now you're starting on hormone replacement therapy. You're going to want your clinician to reach out to your cancer or oncology team to explain why you're doing that. You don't want that burden to be left on you. It's unfair, it's exhausting, it's confusing, it's actually downright scary. Patients will tell me, my doctor's gonna be so mad about this, right? Now, hopefully, with more time and more education of healthcare professionals, this will go away. But this is why you need someone who can help you navigate the system. Whether that means they're gonna pick up the phone and call your other clinicians, that means they're gonna write something in clear, plain language that you can give to that other clinician with maybe a number or an email if they wanna have more of a discussion. They're gonna leave you with some resources or a key paper or something that you can also give to your clinician. And it's also helpful, huge bonus, if they can make sense of what the other clinicians are doing and saying. For me, that might be somebody who's working with a rheumatologist, and the rheumatologist is changing their medications for rheumatoid arthritis. And I know how that may affect their hormone therapy regimen. cool. I now know what those other clinicians and team members are doing and how it's going to impact her menopausal journey, perimenopausal journey, and her hormone replacement therapy. So the first way you know that you're working with a true expert is they're helping you to navigate your other healthcare team and the system in general. All right, so on to number 2. The second thing that I think an expert should be doing is helping you build your confidence in your menopausal hormone therapy regimen, right? So it could be hormone therapy, or actually, interestingly, in my case, I'm actually pulling some of my patients off their hormone therapy. That's a story for another day. Whatever your regimen is, whether it's over-the-counter lifestyle and supplements, whether it's non-hormonal medications, or it's hormone replacement therapy, they should be building your confidence in why you're taking what you're taking, especially the menopausal hormone therapy. Now, this is important for a couple of reasons, but let me just kind of tell you a funny story that I had with a patient. So she was starting on hormone replacement therapy, and she asks me, what are the extra risks? We'd already covered some of the scary things like cancers and strokes. And I said, well, the most common risks from being on hormone therapy is bleeding, breast tenderness, and your doctor, your mother, or your sister telling you that I'm trying to kill you. And that, unfortunately, is still where a lot of patients feel that wedge, where they feel like they're doing something right, but someone tells them that they're not. That's where the building confidence in your regimen comes into play. Not only do I want to start you on hormone replacement therapy, if, again, we're going towards that option, but I want you to really know, why is it safe? I want you to know the answers to some of the questions that they're going to throw at you. Oh no, I know that causes cancer, right? You're going to know why it doesn't. And not just the safety, but I also want you to know why you're taking what you're taking. Why are you using the patch? Why are you using the patch and a little bit of gel? Why are you not taking progesterone yet if you're in perimenopause? There's lots of different scenarios. So not necessarily, this show isn't meant to like cover all of those answers, but each of my patients, and I've now seen thousands of patients over the last 10, 15 years, put them on so many different hormone therapy regimens. And I really want them to know why they're on that regimen. That's why it's so wonderful at my private telemedicine practice. I have so much time to really help my patients. Now, when I was in an academic medical center, I didn't have as much time with patients. That's actually, fun fact, why I started this podcast back in 2018. Now I have this beautiful studio and so much to help support me. But I actually started the podcast in 2018 as a way to extend those 15 minutes that I had with patients when I was working at Ohio State in Columbus. So even if you don't have necessarily all the time in the world with your menopause specialist, if they're helping you build your confidence in some way, shape, or form, it can be as simple as, here's a couple of resources like these books, these podcast episodes that I recommend you listen to. Or it could be, the in-depth time that you get with your clinician. But building the confidence as to the safety of your menopausal hormone therapy regimen, particularly if you're in perimenopause, because there's so many myths that you can't be taking menopausal hormone therapy if you're still bleeding, if you're still in perimenopause. I break all of this down in my new book, The Perimenopause Survival Guide, because that couldn't be further from the truth. Or it's like why you're maybe on an unconventional regimen, which, trust me, there is so many ways to mix and match FDA-approved hormone replacement therapy. There's different doses, different routes, different formulations, different timing. It's also different. Knowing exactly what you're doing, why you're doing it, and why it's safe is something an expert will do for you. Okay, let's get on to number 3. So number 3 is something called shared decision making. If you don't know what that is, it's exactly what it sounds like. You're making a shared decision. So why is this so important? Well, a lot of my patients tell me that they really love getting to work with me. Who wouldn't? But they love getting to work with me because I feel more like their tour guide. I'm making sure what they're doing is safe, it makes sense, I'm building their confidence, I'm helping them navigate the system, but I'm not saying, here's the one way, here's what you're gonna do. Every once in a while, I do. But 99% of the time, I kind of have a option A, option B, option C, and that's called shared decision making. Let me tell you what this looks like in my practice and how I see my patients. The first thing that I always do with my patients is actually help them drill down what is actually the number one symptom that they want to resolve. That's going to help me in the shared decision making process. For some women, it's the sleep. In fact, I saw a patient early this morning. Her sleep has been so disrupted exhausted. She can't have the energy to work. She's not having intercourse with her partner, and that's really straining their relationship. Another patient I saw, she said it was the weight. She said the weight is just making my joints hurt. I'm tossing and turning because I just feel like I'm having like snoring episodes in the middle of the night. That was her number one symptom. That's the first thing when it comes to shared decision making. No expert should tell you what your priority should be. Now, here's some caveats. Sometimes things are more life-threatening, right? If it's more life-threatening, then yeah, that's a time where maybe a doctor should say, you need to take this medication for your blood pressure or something terrible could happen. So there's definitely reasons why you should listen to a clinician in an emergency. But perimenopause, menopause, it's not so much an emergency. And that's actually one of the problems if we never actually though drill down and distill what you're feeling, how you want to treat it, and it goes for years. This is a huge problem. But first we think about your number one symptom. Then we think about your health goals and your priorities. So you might say, well, with the weight, I really want to do this by not using medications. I really want to do this by lifestyle. I really want to do this by whatever it might be. Maybe it's, again, the sleep. And she says, I want to do this by hormone therapy, Dr. Hirsch, right? Or you could flip-flop those. I really want to use a semaglutide, a GLP medication to help me lose the weight. I want to know what is your approach, just your instinct, your gut feeling. Then here's something that I do and I've done for a really long time. I ask my patients, like, do you have a guess as to what might help you? And sometimes they're like, I don't know. That's why I'm here. I want you to give me the answer. And I got you. The reason I ask that is because you're probably living under a rock if your Instagram feed or your social media feed is not filled with suggestions for you. Whether it's someone like me, hi, I might be on your Instagram feed, or it's a supplement, or it's a device, you might have a gut feeling about what you might want to try. And women are so intuitive. So they may say, I tried this before. I did this when I was doing IVF. I did this after I had a baby and it really helped. And I have a feeling it could help again. Those three questions are so important. What's your number one goal? How do you want to attack this goal? And number three, what's your guess as to how we'll really go ahead and tackle this? That's where I really formulate this idea that we've got plan A, plan B, plan C. And in each of those plans, I like to say, here's what could happen in the best case scenario with A and the worst case scenario with A. The best case with B, the worst case with B. Best case with C, worst case with C. That's what I kind of call war mapping. And that way we know specifically if plan A doesn't work, we're going to go to plan B and then we're going to go to plan C. Or maybe you like plan C the best and then you like plan A, plan B. Doesn't so much matter. You get the point. But we have a whole war map and we use shared decision making. That's something that I think only an expert will do with you. And it's crucial because not only do you feel like you have a real partner who's helping you navigate the system, who's also really helping you build confidence, but you guys are doing it together. This, my friend, is something a real expert would do. Okay, now I'm going to plug my own private telemedicine practice, The Collaborative. So, I just love doing this type of medicine because it is so fulfilling and it's so individualized. So I was in academics for 6-8 years. Then I started my own private practice in 2023, and I've now grown it to have clinicians who work alongside me. And we do so many amazing things inside the collaborative. We do so many events. We have a community, and then you get unlimited visits with your clinician. So that's the collaborative. Go to jointhecollaborative.com if you want to learn more. And now, after that little plug, I'm going to go on to the last and the most important, which is you want to find someone who can answer every single question that you have. All right, so this is really important because what I've found over the last decade plus is that women are complex and women are brilliant. Put those two together and oftentimes you have so many questions. For example, is the lining of my uterus okay? What do I do if I have progesterone intolerance? Can I take it 10 days? Can I take it 12 days? Can I take it 30 days? A lot of this comes down to how much that clinician has spent in the field working with other patients, because there's not always a straightforward answer. But you do want somebody who takes your question seriously and takes the time to answer it to the best of their knowledge. And because there's a lot of data-free zone when it comes to perimenopause, menopause, and hormone replacement therapy, or even let's talk about testosterone, you do want somebody who still gives you an answer that satisfies the itch that you have. Sometimes with my patients, once they feel amazing, we might actually spend an entire visit just answering some of the questions that they've they've found on social media. Here's an example of a question that I get asked a lot that I don't totally know the answer to. Hey, Dr. Hirsch, is hormone therapy going to help my brain and prevent dementia? You might have heard a lot about this just on social media about the brain impacts of estrogen. And what we do know, this is how I would answer this question for a patient, is that the Women's Health Initiative memory study, called WIMS, actually found that there was an increased risk of the use of hormone therapy and having dementia, but in women who are older than age 65 when they started. So there is no current study that is long-term about using hormone replacement therapy, specifically the estrogen, in younger women and preventing dementia, because that study is actually now ongoing. But if it's actually going to be preventing dementia or decreasing the diagnosis of dementia, if we don't even want to go so far as to say it's preventing it, we still need 10, 15 years to see if that is true. But what I can do is show you and talk to you about why I think that's probable and some of the data that already exists to help you see why I think that's probable. For example, I could show you some studies about how using estrogen helps to light up certain areas of the brain, and that in women on hormone therapy after they've gone through menopause, it relights up the brain, right? So I don't know specifically the answer that yes, hormone therapy prevents dementia. But I, as an expert, think that that is very likely, and I want to show you some of the research why I think that. And because I've been doing this for such a long time, and I have patients who have been using hormone therapy for decades, I can tell you my clinical experience. We'll get back to that in a second because it's really, really crucial, is that women have less brain fog. They tend to work longer, they feel better. And so adding that in the mix, I think it's more likely. So this is a great example of a question you might have on social media. You might see two menopause experts going at it on social media, and you want to know, what does your doctor think? And when they just kind of say, yeah, it definitely does, or I don't know, those are not satisfying answers. So the clinical experience I mentioned before, it's really key. It means that that doctor that you're working with has spent a lot of time in this area. Now I'm going to talk to you about how do you find a clinician like this. Again, there needs to be more. That's going to be the TLDR there, but that clinical experience is really, really gold. And in my field, as a doctor myself, as someone who goes to a lot of conferences, researchers definitely get to be on podiums a lot more than the doctors who see patients. But having a clinician who really is, seeing a lot of patients means that they're going to have some specialized knowledge that can really help you. Here's another example that I see. I have patients who really debate how often or how much progesterone they should take. This happens every single day. In fact, I get tons and tons of DMs about this. Hey, I'm on this dose of the patch. I take this much progesterone. My doctor actually says I should do more, but I actually want to do less. It's hurting my stomach. It's making me woozy. How much progesterone do I need for my estrogen? The truth here is that actually there's a lot more research that needs to be done, but having someone who can really answer this question for you in depth is going to build your confidence in your hormone therapy regimen, which I already said in the show is going to be really, really important. And there may be more than one answer when it comes to how much progesterone is enough for your estrogen dose. Now, they could pull from textbooks, they could pull from what we kind of call small scale studies, they could pull from their clinical experience, they could pull from history. There's a lot of ways that your clinician can answer this question for you, but you just want to feel satisfied and safe with that answer. So having somebody who can answer questions for you in depth is really, really important. I'm going to give you one last scenario. There's a lot of new peptides on the market. What's a peptide? Well, you've probably heard of one, Ozempic, Wegovy. These are semaglutides. These are in the peptide family. Now, these are FDA approved for things like diabetes and weight loss, but there's also a lot of off-market peptides. My patients ask me about this all the time. And actually, I don't know enough about this new field, but what I can say is, I'm hearing a lot about this too. Let's look this up together in real time. Even if your doctor only has 2 minutes, sometimes I might have more like 5 minutes. Now I do a lot of telemedicine, so we might do a little screen sharing and kind of start to learn together. And I might say, tell me why you're interested in this. Is this something you do want to do? Is it something you have maybe like already pushed the button on an ad for, but you want my opinion? And let me look this up and get back to you. Because I bet, again, being someone who sees patients, they always have their finger on the pulse. I bet another patient's going to ask me about this as well. So I'm going to take the time to actually get a little bit more in depth, like studying this or researching it or taking a class on it, and get back to you. This is how you know you have an expert. And it could not just be menopausal medicine. It could be your primary care doctor. It could be applied to that. It could be your OBGYN. It could be your naturopath. Anyone who's doing these 4 things makes you feel confident that you're working with an expert. All right, let's get to the difficult part. So how do you find this unicorn clinician, right? And again, this can be applied to whatever field you're looking at, whether it's a clinician, whether it's a surgeon, whether it's a licensed social worker. There's no right straight answer for this, but let's distill down to someone who might do menopausal medicine, because you might be listening to this podcast because this is an interest of yours. Here's a couple places that you could look, but it is not foolproof, okay? It's not foolproof. Now, I'm a little biased, so I'm going to say go to the HeatherHirschDirectory.com, HeatherHirschDirectory.com. This is a list of clinicians who have taken my course, How to Prescribe and Manage FDA-approved hormone replacement therapy with ease and confidence. That means they probably think a lot like me, and my students go through a 12, 15-hour class, and then there is countless extra hours of difficult cases that I do. If you are a clinician, you can go check that out at HeatherHirschAcademy.com, but anyone on the Heather Hirsch directory probably has the same type of thinking process as I do. You can search by state. You can see if they're in person, if they're virtual, telemedicine, or if they do a hybrid, if they take insurance or not. But I'm a little biased. I think that's one of the best places to start. The second place you can go to is menopause.org. This is a registry of everyone who is in the Menopause Society's certification program. That means those doctors on menopause.org have taken and passed an exam that helps them become certified in menopausal medicine. Now, I will say there's a little difference between the textbook, which is a little exam heavy, and real clinical experience, which I just talked about. So you could look there as well, because this will give you more groundwork. On menopause.org, you might also find pelvic floor physical therapists, social workers, psychologists, and more. So it is also a great place to look. You can also look at ishwish.org. That stands for the International Society for the Study of Women's Sexual Health. It's definitely a mouthful, but that's ishwish.org, and you can find a clinician there. Lastly, of course, there's the collaborative. That's my telemedicine practice. Check out jointhecollaborative.com. If you find a clinician like that, also please thank them. If you are like, I have someone who has 2 out of 4, great, you're halfway there. And honestly, I always say, please feel free to advocate for yourself and kindly ask your clinicians what you would like them to do. You could even say, I love that you help me navigate the system and that you'll look step up with me, but I'd really love if we could use more shared decision making. They all know what that means. And they'll say, oh, okay, you want more of a role. And sometimes it's just a dynamic shift that can help the clinician that you're working with, who you love, be a little bit stronger and better. So spread the love. Take what you've learned in this show and spread it to others. Thank you guys so much for watching, for listening. If you love this episode, if you love it, please write a review, leave some stars, give it a thumbs up. That helps the algorithm send this out to more women, and it tells me you like stuff like this, so I'm motivated to make more. I thank you so much for your time. I'm so grateful for your presence and for your attention, and I will see you on another episode. Bye, guys.